Jason, how you doing?
I'm great. Fantastic. What about yourself, my man?
I am doing just fine. Not as probably as good as you. So we are filming this, taping this, whatever you do. What do you call a digital recording? I guess digitally recording this on the Monday after your fantastic Transform Dental Sleep Conference. Is that correct?
That is correct. It was fantastic indeed.
Was it? Was it?
Yeah, it
Was it?
was.
Was it? So this is your second annual Transform Dental
Yeah,
Sleep conference. Is that correct?
that's correct. We were still able to hold it down despite you not being there this year, but you were missed.
Was I? I'm sure I was massively missed. But it was good.
Yeah, absolutely. It was a ton of fun, a lot of good content, education, wisdom, knowledge, experience shared from the stage. It was a blast. And, you were there in 2024 for our first year. And, it's an iterative process. So it just got better this year. And we're already planning 2026. So it'll be bigger and better next year.
What was the mood entering the arena? Like, where were things? Was there any? Uh, was What was the vibe like this year versus last year? And I feel like part of the question is what's the vibe like in the dental sleep medicine community holistically, apart from the conference right now?
Yeah, it's really optimistic. There are a lot of positive changes, both from the insurance standpoint to a lot of the barriers to entry are lowering, and there are a lot of new developments and innovations with remote patient monitoring and some of these things that are really kind of moving the industry forward. So yeah, there's a ton of optimism, and that's shown through during the conference because there was really a positive vibe overall.
Good.
And
That's
and you
good.
know and you know one other thing, you were there in 2024, and you might recall there was a freakish cold front and rain that came in. And this year, it was one of the most beautiful sunrises I've ever seen, and the temperatures were in the 70s. So it was you had that as well. Everybody loves to talk about the weather.
Exactly. I guess especially in Arizona when it's yeah, it was. I remember last year it was like this. It was the dusk kind of really weird vibes. It was really cool though. But anyway, so
Yeah.
weather happened and weather came and weather went
Yes.
as these things do. What was the I know you love them all, so I know you can't actually answer this question. Was there one talk or session that sort of surprised you, either positive? It's only going to be in a positive way. We'll go on the upswing.
Yeah, I mean, there were a number of I'll tell you this. All the attendees complete a post meeting survey, and they share their feedback on the different presenters, the topics, what they like, didn't like, etc. And Aaron Elliott is always a hit, and it's funny because I've hosted different meetings for years, and Dr. Elliott is always concerned about sort of overexposure because she speaks so much across the country.
Mhm.
Um, and we had her speak, you might remember, in 2024, and her presentation was rated so highly, we brought her back again for 2025. And she was a little reluctant because, again, that fear of sort of oversaturation, too much Elliot. And she was among the highest rated speakers. Um, our our keynote speaker is a guy named Hella Sidibe, who is a runner. He's the first African to actually run across the entire United States. And he comes from extreme poverty in Mali and has such an incredibly positive attitude. And he sort of shared his experience with everyone, and so many of the surveys commented about how inspiring his story was. Um, I would say that what I found most interesting personally was we had a panel discussion about sort of the current or the future of dental sleep medicine. And we had on that panel, we had Scott Craig from Midwest Dental Sleep, Len Liptick, who is the CEO of ProSomnus, Randy Curran, who is, I refer to him as the Oracle of Medical Billing, but he is the CEO of Pristine Medical Billing. And then, gosh, who else was on that panel? We had someone else, and they were important. Who else do we have on that panel? Scott Craig. We had someone else on that panel. And
That's okay.
but yeah, just talking about sort of what's on the horizon 3 5 years out in dental sleep, and parts of that got pretty contentious, especially when we're talking about sort of the roles of professional organizations and furthering the field. But that was getting a little grit and some disagreement, some healthy discourse in the conversation was really interesting.
Sure. And what was the, I know you have to be sort of, well, you don't have to be anything, honestly,
Yeah,
but
sure. Yeah. It's us.
there are
Come on.
sensitivities around certain things, but I guess conceptually, not everybody was in agreement about the place for various companies, various industry groups in relation to dental sleep medicine. Is that sort of?
That's fair.
What?
Yes.
Okay.
Everyone has this, same desire to see the field move forward. Of course, more dentists, more clinicians helping more patients. Just not everyone agrees on exactly how to get there.
Sure. Yeah, I mean, and why would they? I mean, I guess, I mean, like, is it a normal, is it normal to believe that everybody in an industry would like, we like the word a couple years ago at this point, kumbaya. Is it
Sure.
normal or reasonable to believe that everybody would get on that stage, hold hands, and like sing a spiritual about how we're going to all work together? Like, nobody expects that, I don't think, right?
No, I don't think so. I think, but reaching some consensus on some key points is the ideal. Otherwise, in this already, pretty fragmented field, um, everyone's just kind of doing their own thing when there needs to be, a little more sharing of resources to drive this machine forward. I think you'd probably agree with that.
I don't disagree. What is if we had like a if we were building a foundation of can we all just agree on fill in the blank in dental sleep medicine? Like what would be a foundational block that you believe that let me go this way that likely either I don't know how you say it that everybody is there some foundational block that everybody on that panel would agree with or not? There may
Yeah,
not be.
yeah, yeah. There is, and we've talked about this a couple years ago. At this point, it's really all about awareness. And how do these groups in this industry, how do they reach some consensus about how to increase awareness amongst dental colleagues about their role in treating this, amongst physician colleagues about how to collaborate, and then with the public just to increase awareness about the importance of sleep health and what the different treatment modalities or treatment options are for those that have sleep disordered breathing. So everybody agrees that there needs to be a more robust engine driving that forward. What everyone doesn't agree on is sort of who's responsible for that and how to corral resources to really push that forward.
Or do you feel like, now I guess you got like a nice kind of, what do you call this? Well, it's a built-in clock of time. So between your first conference and this conference, has awareness in your mind increased of significance?
I mean, of significance. I mean, I guess that's relative. I mean, if 5,000 more people know about it. I mean, Advent does a ton of marketing in the markets that you're in, so that's increasing awareness. Um, you know, uh, There's a number of different organizations that are trying to do some of those things on their own. I guess it's just and this was something that was mentioned a couple times during the meeting. It's if you want to go fast, go alone. If you want to go far,
Mhm.
go together. And I think there needs to be while kumbaya is unrealistic, uh, there needs to be a little more hand holding, um, or some high fives at least.
Sure. Yeah, possibly. I think, and I don't know if you guys talked about this or not, but I guess one of the things that I've been aware of in the dental sleep medicine community is the, what do you call these? The direct to patient platforms. I think there's a
Yeah.
few of them out there. Did those get much airtime at the conference?
Yeah, there was some discussion about that during the that panel discussion I alluded to earlier, and while everyone loves the idea of lowering the barriers regarding access to care, um, the idea that there should be licensed professionals sort of managing that care, ensuring that devices are fabricated appropriately, ensuring that side effects are observed, mitigated, that patients are monitored and getting the best care. That was key. And, you know, one of the things that was sort of what those direct to consumer models were compared to is Smile Direct Club, which was launched a few years ago, and while it got a bunch of it'd be a bunch of business, corralled a bunch of dollars in investment, really it was an abysmal failure, and resulted in a slew of litigation by dissatisfied patients that were frankly poorly treated. So the aim is to not see that replicated in with the oral appliance therapy and the oral appliance market.
And do you feel, and I guess I'll ask you as a person, I mean, it's sort of different than what the industry feels, but do you feel like that's just like an inevitable, is that just the inevitable destiny for these models? And to be, let me, before we get into it, I guess just for those who are listening who don't know these models, but so these models are direct to consumer. So they're marketing to patients who have either known sleep apnea or they believe to have sleep apnea, and they're marketing oral appliance therapy that's fabricated and delivered to the patient, and patient there then is put into therapy remotely. I guess is that a pretty good description of it?
Yeah, I mean, just to add to that a little bit, it's a way to essentially circumvent the healthcare provider and in turn reduce the cost to the patient.
Yeah.
But I would say that you're probably reducing some other things as well, like provider oversight. And, these people went to school and got training and gleaned a lot of insight on how to manage patients. So
Sure.
that's pretty important.
So then just from a, let's go pros on this model. Access would be one pro. Like more people would have access to oral appliance therapy with this
Mm.
model. I'd say kind of the thing you were pointing out. I'd say okay, and the price point or cost is likely lower than what a full service in person dental sleep practice would be typically able to offer. Is that are those two positives
Yeah,
for the most part?
those would be potentially two pros. Yes, yeah.
Two pros. Any other? I'm trying to think. Are there any other? I mean, in the broad bucket of access would be convenience might be a third thing, but you might just tuck that in access, meaning that
Sure.
somebody from the comfort of their own home could potentially get diagnosed with sleep apnea and get put into therapy. Not in one moment, but basically in a couple of steps. So I'll put that as either that's, I think that might be slight. So I might go three, access, price, or, you know, price. I guess there's probably a better word than price. What's a word, another word for low price? Um,
Affordability.
affordability. So access, affordability, and convenience. Is there a fourth on the list of like, these are positives or
I'd say that'd be about it. And each of
that's it?
those, well, go ahead and go with the
No,
potential.
I'm just trying to, so
Yeah.
those are, it's kind of how we started, I'd say. Those three things are meaningful. I mean, meaning that if the goal is to decrease the barrier to entry for oral or towards oral appliance therapy, then these three factors are directionally correct, right? I mean, they would open the doors up more widely than they are right now, to folks who have these issues. Again,
Potentially,
I'm
yeah.
trying to spin the positive, but on a positive note, I'd say that's my okay. They're doing something. These companies are, um, they're serving a part of the market that's not currently being served. We'll sort of kind of call it that way. On the negative are some of the things that you just described, which is basically, yes, people might have greater access. Yes, this might be a lower price point, but there's not the there isn't the same. I don't know if I have a list like the type three of the positives, but I'd say, well, we could try to get one. On the negative would be, um, what do you call this? Is lack of oversight the right thing? That's not the right word. What
Yeah.
would you call the lack of, um, clinical care? Um,
Well, lack of clinical care. I think you just
okay,
said it.
all right, that's fine.
Yeah.
The lack of, all right. So we'll say, well, and the negative with that are some of the things you kind of mentioned before, which is, this is, this this is I mean, at the end of the day, this is a medical therapy.
Mhm.
It's treating at the end of the day, it's treating what can be a life or death disease. Many of these patients, we've got one shot to do it right, and if we swing and miss, we might, disenfranchise those individuals from ever seeking care again. I'm trying to like build this up as a like, so it is really important, to have, somebody with specific expertise, on the ground with patients in real life, making sure that,
Well,
they're selected
Mud,
properly in the clinical care.
let me
Yep,
pause you there for a moment. Just
yep.
give me a 30-second rundown of the negative health aspects related to untreated sleep apnea. What
In
are they?
30, uh, almost everything downstream from the airway, can be and typically is negatively impacted if you have sleep apnea. So
For example,
heart attacks and strokes and diabetes and depression and anxiety is one that shows up more often than not, and erectile dysfunction, and you name a body system, that is kind of gets pissed off at not being able to breathe, and the fight or flight reflex, that gets created because of that. And you pretty much listed every body system in the human body, I would say, is going to have some negative impact on it. The most, um, poignant are the cardiovascular ones in particular. Heart attack, strokes. I'd sort of say, again, if you're a human being walking around the world in this world, and a couple of things that you want nothing ever to do, anything with, one would be a heart attack, another would be a stroke. And it's not a guarantee if you have untreated sleep apnea that it's going to happen to you, but you are dancing with the devil that way. You definitely, or if you have, an airway issue that's not being treated, then that's a ticking time bomb. And a lot of times this stuff goes off and people, never know about it. I go back to back to your conference, back to awareness, back to this whole situation is if somebody if somebody dies from, as a result of as an ultimate result of untreated sleep apnea. Nobody ever tracks that back to the sleep apnea. No credit is ever given, and nobody ever says, yeah, Johnny, boy, he snored up a storm, and I wonder if that might be related. I think nowadays there actually are some of those sort of side conversations at
Mhm.
funerals, to be very morbid,
Mhm.
about like, I wonder if that had something to do with it. But more often than not, it's not the case. So, yeah, I mean, I think at the
Yeah,
end of the day, yeah, go ahead, go ahead.
well, I was just going to say, so yeah, I mean, based on everything that you just shared, it's probably less than ideal that you're sitting in your kitchen, um, treating your own sleep apnea. You should probably see a doctor. And by probably, I mean absolutely.
Mhm.
And not treat this, via mail order. Uh, it's just far too serious. And I think you would agree with that. Yes?
I I'm a I am somebody who is open to disruption. I don't disagree with the premise. I guess you could take it the opposite way. And I haven't really taken it one way or another. I'm sort of, I'm here as the devil advocating. So that's what I do. So as the devil advocating, I would say, yeah, but everything I just said about sleep apnea says how impactful it is. And we haven't talked about the fact, and kind of back to your conference, and not just dental sleep medicine, but um, all of the specialties who focus on airway breathing issues um, have done a horrific job in promoting awareness, spurring, calls to action to actually do something. And so we've talked about this. Again, I don't, I, when necessary, I'll dwell on the negative. And again, as a man who's trying to play the devil and advocating in that way, I'd say,
Yeah.
let me go. Let me to go full. I'd say, man, hey, dental sleep medicine, love you, love the work that you've done. Hey, sleep medicine holistically, love you, love the work that you've done. But at the end of the day, there are way, 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 way more people out there who have these conditions that you guys say you can treat and don't want anything to do with the system that's treating them, including you. And so, that's the part that really the current system fails more people than it helps. That's the truth, whether it's the dental sleep medicine community or the sleep medicine community holistically. And again, most of the time when I'm talking, I'm sort of focusing on America. I don't think it's that much better than the rest of the world, but I'm just sort of to kind of put my parameters up. And I'd say those are true. That's true too. I mean, so I think this is sort of the dance of is suboptimal we'll call it efficacy or whatever you want to. A suboptimal treatment protocol that has tremendous access and I'll just keep it that simple, and tremendous access, there might be a place for that. Is it the gold standard?
Mhm.
Is it something that we can hold up and say, this is going to meet exactly the same standard as somebody who goes in to a dental sleep medicine specialist, gets an evaluation, gets fit if appropriate, gets put into appliance, gets titrated, gets the whole shebang. Is that apples to apples? I'd say no, it's not really apples to apples. It's like apples to pears or something. But again, I go to, there isn't a pathway that currently exists to connect all of the
Yeah.
people in this country who would like access to oral appliance therapy to oral appliance therapy. So,
Yeah.
yeah.
Well, I think another issue though with this direct to consumer approach as it exists today and in the foreseeable future. I mean, it's not just this suboptimal care. It's the fact that, these few organizations that are trying to disrupt with this model right now, realistically, they don't have the funding to really drive awareness either. These are small organizations. So I mean, in that regard, I mean, I can't speak to their motives. I'll assume that they're pure and they want to help people while also, making a living.
Hmm.
Um, but it's really just in its current state, and I'd say the foreseeable future, it's really just another sort of splintering of the field because it's not going to really draw. I mean, you might look at it and say it's innovative or it's disruptive, but it's really, I mean, what are they going to do? They're going to do a social media campaign and get in front of a few more people. They don't have an Inspire marketing budget. They don't have an Advent marketing budget. They don't have a Transform Dental Sleep marketing budget. Let's be real here. And back to kind of my point earlier is awareness, increased awareness is key. And I just view this as one, and I'm not a dental sleep medicine protectionist. I mean, we've had this conversation in the past, Madan, you know, uh, some of the things that you're doing that are very disruptive. Um, they're I'd say they're moving the field forward. They're helping more patients. They are driving awareness. I'm a fan. Um, the dental sleep medicine community as a whole, I'm speaking generally here, probably is less of a fan. They're a little more protectionist. I don't share that sentiment. But I do look at this. I look at this as we're not going to reach kumbaya status, nor do I think that that's a favorable end goal. But I do think there needs to be some more solidarity so that we can pool resources and have at least a general direction that we're all headed so that we can pool those resources and drive faster further because people are croaking, people are sick, and there is help available. It's just we're doing, pardon my language, but I think this is apropos here. We're just doing a shitty job getting the word out about it. And there's people that want to help, people that can help, but we've got all of these sort of unnecessarily disparate camps. Um, and it's better to really just rally and kind of march in some sense, some semblance of um, synchronicity.
Understood. Yeah.
Tell me I'm wrong, man.
No, I'm not going to tell. I'm going to tell you that it seems like a bit deja vu all over again, to some extent in my head, which
Nothing
is
changes.
well, but then things do, I guess. So nothing
Yeah.
changes, but now we've got, I guess basically since last time we talked on sort of while we were taping this, these companies are new, so that's change. And I'd say, like it or hate it, it is gonna they're at least, I don't know. I feel like I'm maybe the wrong person to test this because I'm so sort of the social media world has a very clear understanding about me, and they think that I'm this sort of some sort of snoring obstructive sleep apnea person. That's why I get all the messages about it. So maybe I guess what I'm saying is maybe I see an fair view of things, but I see the ads coming through for some of these companies that we're talking about, and some of them are better than others from a pure, like, as a student of marketing and advertising. But I'd say there's more awareness. They certainly are creating some of that. But then I go, and I guess back to your question, like, kind of tell you that you're wrong. I don't know. I'm just trying to think about an area of medicine where and maybe you can help me. I mean, there's probably obvious ones I'm just not thinking about, but I can't think of an area of medicine that have had the same problem, that have been able to miraculously solve that problem by everybody coming together and becoming a unified force. Am I wrong on that?
Well, I don't remember if we did we. Well, let me take this. We're headed in the same direction, but let me jump off on a quick detour. Did we ever talk about the tobacco industry?
I don't think so. Not that
Yeah,
I'm aware
I'm going to really butcher some facts here, but I've got the overall picture pretty accurate. I mean, the tobacco industry for years, and I'm not advocating for tobacco, of course, but the tobacco industry realized that there were going to be increased uh, there were going to be some prohibitive regulations put on them
of.
with advertising. There was going back to the 50s and 60s, an increasing amount of research showing that tobacco use was had a deleterious effect on health, and the tobacco industry realized that there were going to be prohibitions on their advertising, and that would negatively affect their business. So at the time, the U.S. tobacco industry was really four or five companies that owned all these, sub brands, and they put together an organization that was really, it was one part PR, one part, funding, some lousy research, but really, it was to push that industry forward and try to, allow them to keep selling their products, keep advertising these products. And they pooled their resources together to fund that. And I don't remember the exact details, but one of the companies, sort of in this organization that they were funding, their agreement was like they would each contribute 10% of their gross profits or something like that. Well, one of
Mhm.
the companies said, we're a much bigger company. Why would we want to continue funding this? We don't need you guys. And they backed out within a couple of years. They went belly up and were acquired for pennies on the dollar by one of the other organizations. So again, not advocating for tobacco use, not at all, not for a second. But I think that that's an example where these companies recognized that by pooling their resources together, it was really able to drive this industry forward.
Gotcha.
If that
Although
makes any sense.
it does make sense. Although now sort of coming back to this world that we live in today, I would
Mhm.
say as far as let me go this way, as far as pooling resources, dental sleep medicine is one specialty that treats this very serious condition called obstructive sleep apnea, and there are others other than that. So I don't. I'm just again as a realist, I'd say I don't think there's any possibility that the let's just I don't know all the various people, but you know what I'm saying. If say there's like four or five different communities that are would where awareness about obstructive sleep apnea would be beneficial, they're never all going to come together and drive things forward. In my mind, tell me I'm wrong on that.
Well, let's. Well, I would say that you're probably not right there.
Yeah.
As an absolute. I mean, every t- so you've got for example, you have the American Academy of Dental Sleep Medicine. You have the American Academy of Sleep Medicine. I would agree. I think you've sort of touched on this earlier. You skirted this. I mean, both of those organizations, I would say, have been an absolute failure um, to boost awareness amongst the public about this disease and what the options are out there. Um, but those two organizations also have sizable war chests that I would say are um, not being used properly. And then take any of these other professional organizations. Your organization, the American Academy, what is it, of
Otolaryngology.
otolaryngology.
Yep.
Yeah, you know, each of those organizations have sizable resources, but how are they using them?
Mhm.
And I don't think that each of those organizations are going to reach a consensus about exactly how every patient should be managed, that there's going to be some new standard of care that they're all going to agree on, but just sort of the sketch, the shape of what this could look like. I do think that they possess the resources to really um, increase awareness and reach some semblance of a consensus about what that could look like. Yeah, I do think that that's a possibility.
Is it, and again, maybe I shouldn't always play devil, but I'm gonna say, is it?
Go for it.
I've
Yeah.
come to find, I've come to realize that I would say almost more often than not, when I see something that seems like it's obvious, like why wouldn't an organization or a person do this? It usually is a feature and not a bug. And meaning it's there's another this they're slightly different, but there's sort of two sayings. I mean, in my mind, this one has been in my head because it's just sort of variety of things I encounter. I'm like there's this is there there's a reason there, like basically the other one I was going to say is follow the money. So if you
Mhm.
use the phrase follow the money, that usually will lead you to the place of, oh, that's why we do it like that. And then on the flip side, I'd say, and it's kind of what I was just saying, it's a feature, not a bug. Meaning I'll go dark and deep, and I have nothing against the American Academy of Dental Sleep Medicine. Maybe I should pick on somebody else. I'll pick on the American Academy of Sleep Medicine. I don't know why I pick on people to begin with or organizations, but I'm just going to say is they're there very well may be a benefit as to why they want to sit on their war chest about these things. And I would say, and I haven't really thought about this before, but I'd say when I think about it, I'd say, well, what could that possibly be? Who wants people to be, who wants people to be suffering from obstructive sleep apnea and dying from obstructive sleep apnea, yet has a war chest to create awareness, but chooses not to use that war chest? And I'd say, and again, I have no personal knowledge of these folks, but basically, I'd say, well, there are people who are running these organizations where power is something that is important to most human beings. And, what if I created a scenario where we're going to create this great awareness? There's going to be this massive growth of this organization. And man, I'm just the kind of person who can lead this organization. I don't think I could be up top of an organization that's 10 times this size. So, and I'm not saying this is a conscious thought. I'm saying this is sometimes a subconscious thought, which is we're just not going to spend that money right now. I'm not, again,
Yeah.
I'm trying to, I think that, there's a different saying, and I think I've said this before in at least one of our sessions, which is basically, how are you complicit in helping to create the conditions that you say you don't want? So I think coming full
Mhm.
circle, maybe this is a good, riff to kind of come to the end of this episode on, which is back to your conference, back to this thought of awareness, and let's just focus on dental sleep medicine because that's your posse in particular. But I'd say, how, if there's this sort of nirvana, which is there's massive awareness. There is a massive run to oral appliance therapy across the country. So how dental sleep medicine community are you guilty for being for basically helping to whatever you want to call it, solidify the status quo. And I'm not, and this is a universal human trait. So this has nothing to
Yeah.
do with the people in dental sleep medicine, but I'd say,
Yeah.
tell me I'm wrong on that one.
Yeah. Well, I would say that, and I'll harken back to some of our previous conversations. This is this is why, the onus is on every provider
Mhm.
to change the way that they think, change the way that they do things, in their own practices and their own communities, because unfortunately, until there is a solution at scale, which, I know you've been working toward, but until more people are able to harness something like that and really take action, then it's really just going to be sort of all of these individuals that are the ones that are driving any sort of meaningful impact. Um, and but really quickly, just back to some of these organizations. I know some of the people that over the years have headed these organizations, and um, you touched on this, I think, a little bit there. There is a little bit of the Peter principle. These people at play there. These people aren't bad people. They're just they continue with the status quo, and it's like, well, maybe you know what we should do. We should make a trifold brochure instead of just a single page. That would be cool. And then we can have some meetings and debates about whether or not we can afford those, and whether or not we're going to use the Oxford comma or not. And up, I get to go to the dinners and be the president, and then I'll be the past president, and I can hype that on my CV. And
Yeah.
that's just to me, and I would say probably for you too. I mean, I don't respect that. Just that you touched on this now, you touched on this in the past. This is a human issue. So,
Sure.
all of this is a human issue. These organizations are comprised of humans, and until they fix themselves, work on themselves, recognize their personal deficiencies, the organizations will continue with those same deficiencies. So that's a little disheartening. You like to make it dark, but I'm sure at home chemotherapy is coming next, where you too can
Yeah.
do your own dialysis right
There
in
you
the
go.
comfort of your own romper room.
Awesome. Awesome. All right. Well, with that, until next time.